So sometimes HSX knows what's going on with our patients even when we don't. The future, I think, is really exciting to be able to bring physical health information into behavioral health organizations like ours. And so I think being able to use HSX data correlated with the data that we're seeing in our clinics. So that's something that we're really excited about as well, because our clients do consider us their health home.
One of the things that that we've been promoting within the Department of Aging is better coordination and alignment of medical information and social service information. Here's the data I have. What else can we be doing for you? And looking at opportunities to, again, the more social service agencies are connected, I think it's going to increase the efficiency of what we do as a service, which is important when we're talking about things like protective services. We need information quick.
We're thrilled that they have now received NCQA accreditation. We really needed to have at their fingertips near real-time data. That's going to tremendously help us as a plan to improve what we call our HEDIS scores, right? If we can get the data to enable us to close what we call gaps in care for our members, I think that is the greatest value of data exchange.
If they're in a mainline hospital or an outside hospital and, nursing homes, rehabs, things like that, which is extremely beneficial to us because before, when it was just hospitals and they went to a rehab, if we didn't know what rehab they went to, we had no way of following up with the patient. I couldn't do my job with that HSX, just really couldn't. I need it.
We ran some numbers to kind of get an idea of our engagement with members in the hospital prior to HSX, and I think we engaged in less than 100, and now with HSX we've engaged with more than 300.
Our kind of three main goals are improving patients' experiences, improving their outcomes, and if you do those two things, invariably you save somebody money. HSX really kind of supports all those three outcomes that we like to see.
What HSX has been able to do for us and for New Jersey is to not only show the high level of care that a patient can receive from New Jersey partners, it also works for us to identify partners that we should be working with, whether it's pediatric care, cardiology, orthopedic surgery. But HSX truly is, it's this treasure trove of data that we can turn to.
It gives us better insight into our patients' information and the information that other care providers had that we never had before. So when I, train people, I'm like, it's a win, and that's the feedback that I get. I get emails every day from employees saying, we love this platform, truthfully.
I'm so happy HSX exists already because they're thinking about building an infrastructure that we can then utilize and, take advantage of to really improve healthcare outcomes, your relationship with your patients and being able to connect them to the resources that they need that I can't deliver for them in a clinical setting is so powerful.
So we're serving the sickest of the sick, right? And the most vulnerable. So our clients are battling cancer, diabetes, HIV, AIDS. Most of our clients are battling multiple illnesses. So we really want to get integrated with the healthcare system so that when patients are being discharged, they can be connected to MANA to get food as medicine. As going into the future with HSX, the exciting things that we've talked about where we can send data back into the system. The team has been incredible to work with and they never say no.
We collect a lot of data as an area agency on aging. Now looking at data that's more real time, it'll allow us to make better business decisions. Now we should be looking at things like not only how many units of service we're providing and to how many consumers, but how have our services assisted us with making sure that we're validating impact in the community.
The whole social determinants of health piece is obviously really important for the population that we serve. So if I have asked my patient, how are you doing on these things? They don't have to get asked that 5 other times. We want to be able to share that in a way that is patient empowered and enabled and consented.
The HSX database has been really helpful for us in helping the Department of Aging's protective services activity. If you're going to be able to effectively and efficiently help Pennsylvania residents, and the potential that HSX offers to do an even better job of that is just beyond belief, and I'm so happy to be a champion.
I think the sky's the limit for HSX, but I think it's going to get more complicated. There's probably going to be more regulation. There's going to be more integrated care, and HSX is positioned right at the intersection of all that. So one thing I've learned in looking at the data is having that data all in one place is a great equalizer, and there are just limitless possibilities of what you can do with that data to improve care for the people that we all care about. HSX really has access to data that I'm not sure anybody else does.